Extract 1. Questions 1 to 12. You hear a doctor talking to a patient called Mr. Chong Walton. For questions 1 to 12, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes. Hello, doctor. Good morning.
Good morning. Please be seated. May I know what's your problem?
Well, doctor, I'm getting severe pain on my left knee and stiffness. I'm having severe bilateral knee degenerative joint disease, left greater than right, with significant pain and limitations because of both. Usually, I'm able to walk approximately just half a kilometre a day, but that is limited due to this condition. I had arthroscopy 2 times within the duration of past 18 months. I have been on a long-standing conservative course for these, including non-steroidals, narcotics and injections. Now, due to the progressive and persistent conditions, I have opted for a total joint surgery on the left side.
Okay, what's your age?
48, doctor.
Do you have arthritic complaints as well?
Yes, doctor. I have arthritic complications, including multiple back surgeries for spinal stenosis, including decompression and epidural steroids. I was working as a driver with a beverage company, but now I have retired from my job due to this condition.
Okay, what are the surgeries you have undergone so far?
Inguinal hernia on the left, Baker's cyst, colon cancer removal, bilateral knee scopes, right groin hernia, lower back surgery for spinal stenosis, status post-colon cancer second surgery.
What medications are you taking?
Ambien, 12.5 milligrams bedtime, methadone, 10 milligrams twice a day, lisinopril, 10 milligrams daily. Demerol appears to work the best in handling my pain.
Are you allergic to any medicine?
Levaquin and Cipro cause rashes. Ibuprofen causes my throat to swell. Fortas causes an unknown reaction.
Do you have any family history of disease?
Yeah, cancer and coronary artery disease.
Well, your physical examination results show weight 167, blood pressure 148/86, pulse 78 per minute and regular. Musculoskeletal examination of your left knee reveals a range of -10 degrees extension, 126 flexion. Your extensor mechanism is intact. There is mild varus. You have good stability at 30 degrees of flexion. Lachman's and posterior draw are negative. You have good muscle turgor. Dorsalis pedis pulse 2+. X-rays reveal severe bilateral knee degenerated joint disease, with joint space narrowing medially, as well as the patellofemoral joint with large osteophytes, left greater than right. You have paresthesias down into your thighs secondary to the spinal stenosis. You have bilateral knee degenerative joint disease, significant back pain, status, post-lumbar stenosis surgery. I'm recommending entire left knee arthroplasty. I am prescribing Demerol for pain control to de-addict you from having regular methadone dose.
Extract 2. Questions 13 to 24. You hear a physician talking to a patient called Mr. David Goggins. For questions 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes. Hello, Doctor. Good morning.
Good morning. May I know your problem?
Well, I'm getting frequent nausea and vomiting with an aspiration pneumonia and abdominal discomfort. I had an endoscopy which revealed a small ulcer after dropping my hematocrit. Now I feel anemic. I had a CT scan last week that showed pneumatosis and my cecum worrisome for ischemic colitis, bilateral hydronephrosis and multiple liver lesions. Yesterday I had multiple bowel movements and passing flatus and had epigastric pain.
Okay, what's your age?
67, Doctor.
Do you smoke or drink?
I have a chronic alcohol use, but I've stopped smoking long back.
Tell me your past medical history.
I have chronic obstructive pulmonary disease, history of pneumonia and aspiration pneumonia, osteoporosis, alcoholism, microcytic anemia.
Well, your physical examination shows you are afebrile. Your heart rate is in the hundreds to 120s, at times with atrial fibrillation. Respiratory rate is 17 to 20. Blood pressure 130s to 150s and 60s to 70s. Your abdomen is distended with tenderness mainly in the upper abdomen but very difficult to localize. The CT scan shows pneumatosis in the cecum with an enlarged cecum filled with stool and air fluid levels with chronically dilated small bowel. There is a possibility of ischemic cecum with possible metastatic disease, bilateral hydronephrosis on atrial fibrillation, aspiration pneumonia, chronic alcohol abuse, acute renal failure, chronic obstructive pulmonary disease, anemia with gastric ulcer. I would recommend getting a repeat CT scan to assess it further to see if there's worsening pneumatosis versus resolution to further evaluate the liver lesions and make decisions regarding planning at that time. Since you have frequent desaturations secondary to your aspiration pneumonia and any surgical procedure or any surgical intervention would certainly require intubation, that would then necessitate long-term ventilator care. So I will look at your CT scan and make decisions based on the findings.
That is the end of Part A. Now look at Part B. In this part of the test, you will hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare environment. For questions 25 to 30, choose the answer A, B or C, which fits best according to what you hear. You will have time to read each question before you listen to the audio. Complete the answers as you listen to the audio. Now, look at the question 25. You hear a discussion about common types of neuropathic pain. Now, read the question.
Hello, Doctor. What are the common types of neuropathic pain?
Well, while there are countless types of neuropathic pain, some of the prominent types include carpal tunnel syndrome. Is caused by nerve compression in the wrists and causes pain in the wrist, thumb and fingers. Central pain syndrome can occur after nervous system damage, such as a stroke. Degenerative disc disease, one may feel neuropathic back pain if it causes damage to the nerves entering or exiting the spine. Diabetic neuropathy causes stabbing pain in the hands and feet of some diabetic patients. Phantom limb pain can occur in some patients after a limb is amputated. Postherpetic neuralgia is brought on by an outbreak of shingles and persists after the condition has cleared. Pudendal neuralgia is a type of pelvic pain caused by compression of the pudendal nerve. Sciatica is caused by compression or irritation of the sciatic nerve and often results in shooting pain that radiates down the back of the leg. Trigeminal neuralgia is characterized by shooting neck and facial pain. Question 26. You hear a discussion bronchodilators used to treat chronic obstructive pulmonary disease. Now read the question.
Hello, doctor. What are the different types of bronchodilators used to treat chronic obstructive pulmonary disease?
Patients with chronic obstructive pulmonary disease are often prescribed a bronchodilator, a type of medication for relaxing the air passages to help breathe better. Typically, the medications are inhaled through the mouth using a metered dose inhaler, but also come in liquid, pill, injectable or suppository formulations. The three classes of bronchodilators commonly used to treat chronic obstructive pulmonary disease are beta-adrenergic, beta-agonists, anticholinergics, methylxanthines. Beta-adrenergic agonists are a type of medication that binds to specific receptors in the lung called beta-adrenoceptors. By doing so, they block the trigger to bronchial spasms and allow airway passages to open. Beta-agonists can either be short-acting or long-acting, which are delivered either orally or through a metered dose inhaler. Generally, the inhaled method is preferred as it alleviates symptoms faster. Anticholinergic blocks the neurotransmitter acetylcholine in the central and the peripheral nervous system to its receptor in nerve cells and inhibit parasympathetic nerve impulses. Methylxanthines affect not only the airways but stimulate heart rate, force of contraction, and cardiac arrhythmias at high concentrations. Question 27. You hear a discussion about pancreatic neuroendocrine tumors. Now read the question.
Doctor, what are the various types of pancreatic neuroendocrine tumors?
There are different kinds of functional pancreatic neuroendocrine tumors. Gastrinoma usually forms in the head of the pancreas and sometimes forms in the small intestine. Most gastrinomas are malignant. Insulinoma forms in the head, body or tail of the pancreas. Insulinomas are usually benign. Glucogenoma forms in the tail of the pancreas. Most glucogenomas are malignant. VIPomas, which make vasoactive intestinal peptide. Somatostatinomas, which make somatostatin. Question 28. You hear a discussion about melasma and different types of melasma. Now read the question.
Hello, doctor. What is melasma and what are the types of melasma?
Well, melasma is a common patchy brown, tan or blue-grey facial skin discoloration, normally seen in women during their reproductive period. It typically appears on the upper lips, upper cheeks, forehead and chin of women of 20 to 50 years of age. There are 4 types of pigmentation patterns are diagnosed in melasma: epidermal, dermal, mixed and an unnamed type found in dark-complexioned individuals. The epidermal type is characterized by the presence of excess melanin in the superficial layers of skin. Dermal melasma is defined by the presence of melanophages throughout the dermis. The mixed type includes both the dermal and epidermal type. In the fourth type, excess melanocytes are present in the skin of dark-skinned individuals. Question 29. You hear a discussion about possible causes of arthritis. Now read the question.
Hello, Doctor. Can you tell me what are the possible causes of arthritis?
Osteoarthritis is associated with cartilage damage. Genetic conditions are thought to play a role in osteoarthritis. Age alone is no longer seen as the cause of osteoarthritis. Rheumatoid arthritis is an autoimmune disease that develops as the immune system malfunctions and attacks the body's own tissues. Gout develops when excessive uric acid accumulates in the body and crystals are deposited in the joints. Reactive arthritis causes joints to become inflamed as a result of an infection that triggers the immune system. Usually, this condition resolves. Question 30. You hear a monologue of a physician on granulomas. Now, read the question. Granulomas are tissue nodules of immune cells that occur in diseases such as sarcoidosis and tuberculosis that can damage many organs. It is the chronic activation of the metabolic sensor mammalian target of rapamycin that is responsible for the granuloma's formation. In sarcoidosis, this mechanism leads to a course that is chronic and difficult to treat. Since mammalian target of rapamycin inhibitors belong to a group of drugs already licensed for clinical use, these findings offer new and quickly testable treatment options.
That is the end of part B. Now look at part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about specific aspects of their work. For questions 31 to 42, choose the answer A, B or C, which fits best according to what you hear. Complete the answers as you listen to the audio. Now look at Extract 1. Extract 1. Questions 31 to 36. You hear the discussion between a senior doctor and junior doctors about pemphigus. You have 90 seconds to read questions 31 to 36.
Hello, Doctor. Can you please explain what is pemphigus?
Well, pemphigus is the term used to describe a group of autoimmune diseases which cause the skin and mucous membranes to become blistered. The diseases may affect areas of the body such as the mouth, eyes, nose, throat or genitals. In certain cases, these diseases may be fatal if they are left untreated. Pemphigus disease affects the people from different and ethnicities. However, some studies have shown that individuals of Mediterranean descent and European Jewish individuals are more prone to these diseases. One form of the disease is very common among people who live in the Brazilian rainforests. Pemphigus affects men and women equally, and several studies have proved that the diseases are associated with a genetic predisposition to developing them. The onset of disease symptoms usually begins during adulthood, although symptoms have been found to occur in children. Depending on the layer of skin blistered and the location of the blistering, there are several forms of pemphigus. The blisters always appear on or near the skin surface. Pemphigus vulgaris is the most common form of pemphigus, which affects the mouth first. That can be painful. The blisters will start appearing on skin and mucous membranes that were looking healthy previously. They form inside the deep layer of the epidermis, making the skin so delicate that simply rubbing it with a finger causes it to fall off. Normally this kind of blisters heal without causing any scarring. However, some parts of the skin that have become pigmented may last several months. Pemphigus foliaceus is another common type of pemphigus, in which blisters or crusty sores initially develop on the scalp and face. However, other areas of the body, such as the chest, is affected at a later stage. Often the lesions are itchy, but are not as painful as those that develop in pemphigus vulgaris. Areas of the skin may become moist, loose, and scaly. Paraneoplastic pemphigus is a rare condition that is not actually pemphigus, but shares certain characteristics of the disease. It develops in individuals with certain cancers and results in ulcers forming in the mouth and on the lips. The skin also becomes blistered and the eyelids may become cut and scarred. The antibody that binds to the surface of epidermis cells also targets the membranes of the airways, and hence patients with this condition can develop fatal lung problems. In the IgA pemphigus, the immunoglobulin A, an antibody different from other antibodies, is involved in other forms of the condition, binds to the epidermis cell surface. The blisters are similar to those that develop in pemphigus foliaceus, but at times they are pus-containing bumps. IgA pemphigus is the least harmful type of pemphigus. Pemphigus vegetans causes thick sores to arise under the arms and in the groin area. Now look at extract 2. Questions 37 to 42. You hear the discussion of a physician with junior doctors on pericarditis. You have 90 seconds to read questions 37 to 42. Hello everyone. Now I'm going to explain to you something about pericarditis. The infection or inflammation that occurs in the pericardium is called pericarditis. Inflammation of the pericardial layers arises when the membrane gets thickened and the layers rub against each other. During such a condition, the increase in the fluid volume in the pericardial sac results in compression of the heart, which subsequently affects the functioning ability of the heart. Chest pain is the main symptom of pericarditis, which is normally not considered as a life-threatening condition, and patients may become normal in a few days or weeks. However, in certain cases, the symptoms may last for several months. It is a relatively common heart condition, and around 5% of patients with severe chest pain are diagnosed as pericarditis. Moreover, it is very common in men than in women. It affects people of all ages, but mostly occurs in young adults. Based on the symptoms and causes, pericarditis is categorized into many types. Pericarditis based on symptoms. Acute pericarditis occurs when chest pain develops suddenly, radiating to the neck, shoulders and back. The pain increases during when breathing in or inspiration and while lying down. However, it decreases while sitting. The symptoms may last for less than 3 months and may get resolved in a few days with appropriate treatment. Pericarditis may be idiopathic or due to viral or bacterial infection, cardiac arrest, metabolic disorders or a blunt injury. The condition is also caused by radiation toxins, trauma, or as a side effect of certain drugs. Chronic pericarditis at times persists for a long period, and the symptoms last longer than 3 to 6 months. In such cases, the patient may not have the chest pain, but may experience tiredness, shortness of breath and coughing. Chronic pericarditis is believed to be the result of certain autoimmune disorders such as lupus, scleroderma, and rheumatoid arthritis, where the antibodies produced by the body attack its own cells and tissues. Pericarditis based on causes. Constrictive pericarditis occurs when the pericarditis is associated with a thickening or scarring of the pericardial layers. This starts constricting the heart within the thoracic cavity, which in turn controls its functioning. Pericardial effusion. In a normal individual, the pericardial cavity is filled with about 20 to 50 milliliters of fluid. At times, in patients with specific medical conditions such as severe hypothyroidism or kidney failure, or in patients who have undergone invasive cardiac procedures, there may be a gradual accumulation of fluid within the pericardial cavity, which may often be asymptomatic until the surrounding structures start getting compressed. In such cases, symptoms related to such compressions such as dyspnea, nausea, fullness of the abdomen may manifest. Cardiac tamponade is caused when persistent pericardial effusion causes the pericardial fluid volume to increase up to 80 milliliters or even 200 milliliters, which can lead to malfunction of the pericardium. Therefore, this condition has to be treated as an emergency. Viral pericarditis. Viruses that can cause viral pericarditis include Coxsackie viruses, influenza virus, agents of viral enteritis, human immunodeficiency virus, and echovirus. Upon onset of this condition, the early symptom can be the infection in the upper airways. This kind of pericarditis is simple and can be handled as an outpatient procedure. Purulent pericarditis is a rare disease caused by aerobic and anaerobic bacteria. Recent studies show that procedures such as surgery in the chest region, hemodialysis, immunosuppression, and chemotherapy are dominant causes that result in this type of pericarditis. Tuberculosis pericarditis is also seen in a very minor percentage of patients having pulmonary tuberculosis. HIV patients are at a high risk of tuberculosis pericarditis. There is a gradual progression of symptoms such as night sweats, dyspnea, fever and chill, but any suspected patient should be given emergency treatment. Radiation pericarditis is caused due to recent mediastinal radiation at any time from weeks to months after the exposure. Malignancy pericarditis is mainly caused by metastatic disease. It is common in metastatized bronchogenic or breast carcinoma, Hodgkin's disease and lymphoma. However, it is rare in primary mesothelioma and angiosarcoma. Traumatic pericarditis. Blunt or sharp trauma causes traumatic pericarditis. Invasive cardiac procedures may also cause this type of pericarditis, which includes cardiac diagnostic catheterization and electrophysiological ablation procedure. That is the end of Part C. You now have 2 minutes to check your answers.